There are 3 elements to a successful breastfeeding relationship. Number 1, always, always, always make sure your baby is adequately fed. If they are not getting enough calories through breast milk, they will not have the energy to nurse effectively and remove milk. This can lead to reduced milk supply. While most newborns are able to tolerate some weight loss and underfeeding right after they're born, the amount of weight loss they can safely tolerate without developing medical complications of underfeeding is unique and different from baby to baby because they are born with different reserves. Only they know how long they can safely wait to be fully fed. So if your baby is showing signs of persistent hunger despite adequate time nursing with effective technique, supplement them with bank donor milk or formula to satisfaction. As long as you're removing milk adequately and frequently before supplementation, your body will receive the necessary signal to produce milk. In addition, the supplemental calories will give your baby the needed energy to nurse effectively if they are not getting enough through breast milk alone. Supplemented nursing has been practiced for millennia and has been, in fact, the predominant form of infant feeding throughout the world. Despite the widespread practice of supplemented breastfeeding, mothers commonly breastfed an average of 1 to 2 years. So feed your baby like our ancestors did, with common sense and compassion. Do not feel guilty for supplementing your baby when they need it. This human instinct to protect babies from hunger has protected babies from the dangers of starvation when breast milk is not enough for all of human history. Number 2, make sure you are removing milk. Frequent and maximal milk removal, at least 10 minutes per breast every 2 to 3 hours, are key to giving your body the signal to produce milk. If your baby is unable to fully remove milk, then you can use a pump or manual expression to express milk. There is no reason to force your baby to endure hours to days of hunger in order to serve as a pump to stimulate milk production. Forcing babies to nurse for prolonged periods of time throughout the day can cause them to expend more energy than they receive. This is not only hard for you and your baby, but has led to babies being diagnosed with failure to thrive or malnutrition. Number 3, make sure your baby is getting adequate time practice being an effective nurser. They need time to not only develop the skill, but sometimes the strength to transfer milk effectively. They also need to associate time at the breast with being satisfied, comforted, and loved. We need to provide a positive reinforcement cycle to keep them coming back to the breast if you intend to have a direct nursing relationship. If your baby is having trouble latching or transferring effectively, then get help by a trained health professional who respects your values and your desire to ensure your baby is fully fed. So in summary, number 1, make sure your baby is fed. Fed is best. Fed is first. Whatever your preferred phrase is, make it your mantra. Number 2, protect the milk supply by frequently removing milk, either with nursing or pumping. And number 3, give your baby adequate time to practice nursing. Just remember, we love you, we support you. You are the best kind of mom or parent because you care that your baby is safe and healthy and thrive through whatever way you can best feed your baby. Don't forget to click below for your free guide to safe infant feeding, a guide to help you safely and adequately feed your newborn in the first days of life. You can also get a copy of the Fed is Best book by clicking on the links below. Thank you so much.